Welcome to Medcan Presents. I'm Christopher Shulgan. I'm part of the team that creates content here at Medcan. I'm here with Dr. Aisha Khatib, who is the Clinical Director of Travel Medicine at Medcan. And we are going to allow people to come in for a minute. We're going to allow the Zoom webinar recording to start. Dr. Khatib, how are you?
Great. I'm great. How are you, Chris?
I'm good. I'm looking forward to the start of summer, I think. I feel like we're on the cusp. I feel like, with Toronto entering stage 2, I feel like we're on the cusp of something different, at least, which, there's been a lot of monotony over the last little bit. So what about you? What do you have in store? What are your plans for the summer?
Work.
Work.
Definitely trying to get out, get some fresh air, get some sunshine. I mean, we always have such a limited amount, and definitely keeping up with the distancing though, but the summertime in Toronto definitely will be different this year for sure from what we're used to, but I think it'll just be nice to have some time to relax and then soak up the sunshine.
Absolutely. Okay, well, so let's start. Welcome to flu season amid the pandemic with Medcan's Clinical Director of Travel Medicine, Dr. Aisha Khatib. Here is Dr. Khatib's bio. Okay, you were an assistant professor in the Department of Family and Community Medicine at the University of Toronto. I shouldn't say you were, you are, correct?
I am.
You currently are. Yes.
Yes.
Okay.
Mm-hmm.
You're trained in both family and emergency medicine and recently completed an infectious diseases fellowship in clinical tropical medicine at the University of Toronto. You've completed your certification in travel medicine in New Zealand. And the thing that interests me the most in your bio is this bit about being the team doctor in the rugby union. So can you tell me just quickly about that? And then I'm going to have a follow-up question about that.
Yeah, so basically the rugby union is the national kind of the rugby league in New Zealand. So we almost like provinces, I guess you would call them, but the regions in New Zealand each had a team. So I was the team doctor for the Manawatu Turbos, which actually we were a feeder team to the All Blacks. So about 6 of our guys went up into the All Blacks. So I was really proud that 2 of my players, Nihi Milner-Scudder and Aaron Smith, were actually in the championship a few years ago. So that was quite exciting.
And so what was the most interesting injury that you came up against?
I would have to say the scariest was a potential C-spine fracture. There was a fracture there, but it was just a near miss to preventing kind of a full out potential paralysis or risk. And of course, a lot of concussions that we dealt with.
That's, gosh, yeah, those guys are so tough, I think. Just watching, they seem to grow them tougher, although our hockey players are tough, but they seem to grow them particularly tough in New Zealand and Australia.
Well, they've made it very clear to me that rugby wasn't hockey. Coming from Canada, they, especially some of the Samoan and Fiji guys, they were like, this isn't hockey, right? And I was like, got that.
Thanks for the clarification. Okay.
Yeah.
Okay, so Aisha, why don't you start your presentation and we can kind of go from there. Oh, and I should mention, we will be taking questions at the end, and folks, you are able to ask questions with the Q&A function, which is down at the bottom of your screen. If you're on a cell phone, I think it's a little different. But anyway, press Q&A button, ask the question, and we'll get to it.
Great. Thank you so much, Chris. And thank you, Medcan, for having me speak on this very pertinent topic at this point in time. So today I'll be talking about kind of entering flu season amid the pandemic, and we'll get into why that's such a relevant topic, especially in June when we're not even close to flu season. So let me just on here. So as you know, we're currently in a pandemic of COVID-19, and we know that although both influenza and COVID-19 are infectious respiratory illnesses, they are caused by very different viruses. And I know in the beginning of this pandemic, there was a lot of rhetoric heard that, this is just another flu. Really, COVID-19 is not just another flu. It's actually caused by a novel 2019 coronavirus, which has never previously been known to humans. And as such, there are a lot of unknowns about this virus and about the potential progression of what we may see in the future. To date, There's approximately 9.5 million cases confirmed worldwide with over 485,000 deaths, and there's no vaccine available at this time. So compare that to seasonal influenza, where we get annual epidemics. And then just to rehash, an epidemic is a rapid spread of disease that affects a large number of people within a community or population at a particular time. Flu is caused by several different types of strains of influenza viruses that may be circulating at any time. And the World Health Organization estimates that 1 billion people worldwide will get the flu every year. The estimates that there can be up to 290,000 to 650,000 people that die of flu-related causes every year, with 3 to 5 million cases of severe illness that may be requiring hospitalization. What's interesting is what's the difference between a pandemic and an epidemic. And really a pandemic is if you basically you're adding a P or a passport to an epidemic. So you're giving it a passport to spread to other countries, other continents, and around the world. So instead of limiting it to a certain community or region, you now have it globally. And I know there's been a lot of talk about the Spanish flu back in 2018, and that was actually a pandemic, one of the worst in our history. And as you can see, there was a lot of similarities in the public health measures that were implemented at that time, including wearing a mask. Now, just a quick mention about pandemic influenza, and the difference between our annual epidemics is that the pandemic influenza is something that can't be predicted. There is always an ever-present threat of a new influenza virus that can be transmitted from animals to humans and potentially cause a global pandemic. It's not usually a matter of if, it's usually a matter of when. And we know different animals that can transmit to humans can include ducks, chickens, horses, whales, seals. If we look at the most recent influenza pandemic we had in the 21st century, that was in 2009 caused by H1N1, where there were up to 400,000 deaths globally in the first year. There have been 3 influenza pandemics in intervals of several decades, and during the 20th century, the most severe was the Spanish flu. That was caused by another H1N1 virus, and that was estimated to have caused over 20 to 50 million deaths. There have been so-and-so milder pandemics that have occurred with a cause of up to 1 to 4 million deaths each as well. So why are we talking about flu during a COVID-19 pandemic? And why are we talking about it now in June? So one of the things is preparation. We don't know what to expect for our coming flu season. And usually annually, the flu season can vary in severity. And we usually prepare for it with vaccination and information usually coming up before the season starts. There is also a potential risk of a second wave of COVID-19 as things start to open back up and as we go into the fall. We know this is not guaranteed, but if we look at the history from the Spanish influenza pandemic, there were actually 3 waves during that pandemic. The first wave of that Spanish influenza was in March in 1918. Then it was followed by a bigger second wave in the fall of 2018. And that was actually a lot bigger and a lot more fatal than the first wave. And then that was followed up by a third wave in March 2019. So it would be worth just kind of heeding and looking at potential patterns of previous pandemics. Although, again, COVID-19 is a different virus. And so it's something that we're just going to have to monitor. Also, what happens when the regular flu season intersects with another respiratory infection that's already circulating? So what are the risks associated with a COVID-19 and influenza co-infection? That's something that we don't have a lot of information about. So will there be confounding and compounding variables? For example, will infection be more severe with a co-infection? And also, will the burden on our healthcare system be more severe if there's going to be more need for hospitalization caused by both COVID-19 and influenza infections, as well as the more severe cases potentially if they have co-infection. The other important thing from a work point is that flu can cause missed work, it can result in severe illness, and it can lead to complication risks such as pneumonia and death. The other thing is that influenza is preventable. and we have a safe vaccine. So really looking at being proactive about mitigating potential risks, given that we are in a pandemic. So what can we do to diminish our potential risks and getting sick, as well as protecting others around us? So what is influenza? It's a respiratory infection caused by influenza A and B viruses. In influenza A viruses, they're divided into subgroups based on two proteins of the surface of the virus, H and N, and that's where you hear the designation for flu types being H1N1, H3N2, and so on. And there are potentially about 198 different influenza subgroups, and these can change yearly, and there can be multiple strains circulating in a season, which is why sometimes there's a mismatch, or the vaccine effectiveness may not be as effective for that potential year if there's a bit of what we call antigenic drift, meaning that the vaccine doesn't really quite match up to the targets of the proteins on the virus that's circulating. There's also B viruses. They're not in subgroups, but they're classified based on lineages, which also circulate. And globally, there is an annual attack rate of 5 to 10% in adults and 20 to 30%, which is really meaning the proportion of people who can get influenza in a year. Clinical symptoms include onset of fever, cough, muscle aches, headaches, chills, fatigue, sore throat, nausea, diarrhea, and vomiting, particularly in children, and a loss of appetite. And usually recovery is within 1 to 2 weeks. Now, as you see, a lot of these clinical symptoms do overlap the symptoms that we are seeing in COVID as well. Also, similarly to COVID, because they are respiratory infections, it is primarily transmitted through droplets that are caused by coughing, sneezing, and talking through direct or indirect contact with respiratory secretions. The incubation period for seasonal influenza is 2 days, but can range from 1 to 4 days. An incubation period is really the period from the time of exposure to onset of symptoms. And adults may be able to spread influenza to others from 1 day before symptom onset to approximately 5 days after symptoms start. And of course, children and people with weakened immune systems may be infectious for longer. Now, if you look at COVID-19 versus the flu, both can actually present with severe infection that can result in pneumonia and respiratory failure requiring mechanical ventilation or ECMO, a method of oxygenating blood outside the body. We know that there have been co-infection documented in China. The study that I looked at didn't go into the specifications of the actual severity, but it was picked up on positive COVID patients that they also were positive for influenza. And of course, both influenza and COVID-19 can be transmitted before symptoms occur or by people with no symptoms. So pre-symptomatically and asymptomatically, which have huge implications from the public health standpoint. The other interesting thing about influenza is that it has a seasonal and temporal pattern. So we see seasonal variation in influenza during the winter and summer months in the southern and northern hemisphere, versus in the tropics and equatorial regions of the world, influenza actually doesn't have a season and transmits all year round. This is actually a really important point for travelers, because if travelers from Canada, for example, in the summertime are going down to tropical equatorial region and potentially there's flu circulating there, they could potentially bring that back to the northern hemisphere, for example, in the off season and start spreading influenza strains through that route. And so it may be more important to think about vaccination for travelers in that regard. Influenza activity in Canada begins to increase over the fall, peaking in the winter months. In between, that's usually October to May. But depending on the year, the peak of influenza season may occur as early as fall or as late as spring. And usually there's more than one strain that's circulating each season. So that's an important point that I want to basically look at, because I'm going to talk about a tale of two countries, and I'm going to compare Canada to Australia, which are very quite similar in regards to population numbers. But Australia is actually in their winter season currently and have entered their flu season, and they actually entered it at the beginning of the pandemic. So it's actually interesting to see what's going on down there. So in the Southern Hemisphere, this actually is a graph showing annual Australian laboratory confirmed cases of flu in the last several years. And I want you to bring attention basically to this line here. The orange line is from 2019. And if you look at influenza in the Southern Hemisphere, in Australia, we know that influenza peaks usually between June to August, and their numbers were quite high. Now I'm going to look at 2020 here, and the dark green line looking here. And if you look here, this is where Australia went into lockdown at the beginning of the pandemic for COVID. And look what happened to their flu numbers compared to what's happened previously. There was a sharp decline in flu numbers, and that has actually been maintained up until now. And there hasn't still been any evidence of that increasing back up to their peak of what they usually see in June to August. If we look at the actual numbers, it's actually been the lowest number of cases reported in years in Australia. So if you look at basically last year, 2019, in April, May, and June, the numbers were sitting at about 18,000, 30,000, and 57,000 at around the same time. This was taken from a couple days ago. And comparatively, this year in 2020, look at the numbers of influenza that's circulating. This is a huge decline. In May 2019, there were 30,372 confirmed cases recorded by the National Health Department. In May 2020, there were just 228. So what was done differently? And I think it's important to look at essentially the potential effect of the lockdown and reduced travel that has had an impact on these numbers. There's also the distancing measures that were put into place right away. Kids were staying home from school, and there were improved hygiene measures like hand washing, all of which will also have an impact on influenza transmission. There was also a record number of vaccines available to Australia because they were going into their flu season at the onset of a pandemic, and there wasn't a lot known about COVID at that time. There was a huge surge in regards to flu vaccination for people wanting it, and the demand for it increased. So in a population of 25 million, 16.5 million vaccines were available, and that's actually 3 million more than what they usually offer in Australia per year. A survey done through the flu tracking, basically they surveyed 70,000 people per week in Australia, and it was interesting to see that the vaccination rate or the coverage or uptake of the vaccine was up to 80%, and that was done through their surveys. In March actually, over 2.1 million flu vaccines had been administered, and that was compared to 624,000 at the same time in 2019 and 235,000 in 2018. They also made it mandatory to be vaccinated against the flu if you were visiting anyone in an aged care or long-term care facility. And it was also important to note that these numbers actually aren't likely to be reflective of the vaccine match and effectiveness, because it's actually too early in the season to tell. So a lot of the decrease in numbers can really be attributed to the lockdown, to potentially the distancing measures and the hygiene measures. Now, coming back up to the north in Canada, together, if you look at influenza and pneumonia, they're ranked among the top 10 leading causes of death in Canada. And since 2010, there have been about 30,000 lab-confirmed cases of influenza reported to Flu Watch this year. Annually, there's an average of about 12,000 hospitalizations related, with 3,500 deaths that can be attributable. And this is likely to be underreported, often because there's a lot of milder influenza-like illnesses that aren't reported, and there is also not a lot of widespread testing for influenza. So can we say, okay, the flu season's not going to be so bad because it wasn't so bad in Australia? Well, there's a few differences in the situation that Australia went into flu season versus what we're going to be entering in. And I think that'll be important to note, is that Australia entered flu season and lockdown at the same time. So they really brought their numbers down right at the onset. Kids were being kept from school, international travel restrictions were put into place, and there were strict social distancing measures. Canada will be entering the flu season as we open up. Kids will be returning to school in September, and the travel restrictions will likely be eased, likely leading to importation and exportation of COVID-19 and influenza strains. And already we're seeing more relaxed distancing that's been evident. Canada's influenza season this last year, in 2019 to 2020, showed that there were all types circulating, and there were about 55,000 laboratory detections of influenza reported. Interestingly, the Public Health Agency of Canada reported that by mid-March, there was a sharp decline in influenza that was being circulated. They were testing for COVID and influenza at the same time in March, and they noticed that influenza pretty much disappeared at the same time that the lockdown went into effect, and it was a good 9 weeks earlier than the expected time frame for our influenza season. This just looks at breakdown of the different subtypes that are according to the different age groups. And in kids, usually we primarily see influenza B. Here's looking at a cumulative number of hospitalizations of over the age of 16 by a certain group that does research on this. And you can see the proportion of adults needing hospitalization are over the age of 65 in Canada in the last year. What's interesting is this, though, is that the number of pediatric hospitalizations last year is about 66% on average is usually under the age of 5. But what was different this year was that usually an average number of hospitalizations between 2014 and 2019, this last 5-year period, was sitting here. And for some reason this year, the pediatric hospital rate actually increased. And that's a bit of an anomaly from previous years. And we looked at the breakdown of the influenza circulating in that age group, and it was basically 52% influenza A versus the 48 B. So it could be that maybe there was more A circulating. So that might be something to monitor coming into the flu season this year is potential increased risk for children and influenza. So the CDC noted a drop in flu activity by mid-March, but pediatric deaths had been climbing. And in Canada, there were 206 ICU admissions reported, of which 55% were associated with A, and 81% were among children under the age of 5 years. There were 7 pediatric deaths, which is on average about 8 to 10 deaths can occur in children in Canada from influenza per year. But what was also interesting was that hospitalization rates were increased in school-age children and young adults. These were higher than in recent seasons, and the rates among up to 5 years old were now the highest, even in the CDC on record for the season, and thus surpassed rates recorded even during the second wave of the 2009 H1N1 pandemic. So that's really something that we should be keeping an eye on looking into this coming flu season. I wasn't able to get the vaccine coverage amongst pediatrics, but I know it's not very high, and we're talking about less than 30%. But here I just want to look at vaccine coverage among adults by a select group that was done. For age 65, it's pretty good. It's over 70%. But looking at all other adults with and without chronic diseases, we're looking at between 30 to 40% rate. Now, if you look at Australia's vaccine coverage during this time, we were seeing about 80% coverage, and that really had brought things down. And if you look at herd immunity, or the idea that you need a certain amount of population immunized either passively or actively in the community to prevent transmission, for influenza particularly, that can be anywhere between 13% to 100%. And it usually hovers at around 30 to 40%, it depends. But just even if a COVID pandemic wasn't around, I think there's a lot more that we can be doing in regards to focusing, trying to bring up our vaccination rates in the general population to really decrease the numbers of hospitalization, complications, and influenza that we see circulating in Canada. In regards to this, actually, the World Health Organization did start a global influenza strategy, which they launched on March 11th, 2019, looking at decreasing influenza and severe outcomes around the world. The World Health Organization has said the most effective way to prevent influenza and severe outcomes is from vaccination. And the Public Health Agency of Canada has also endorsed vaccination as the most effective way to prevent influenza and its complications. We also know vaccinated individuals who are protected from influenza will not pass the infection on to others. So there's a National Advisory Committee on Immunization that works to develop the recommendations, and this statement came out earlier this year, and we can expect our influenza season to start as early as October in the Northern Hemisphere. Influenza production has already begun and scheduled for October, with the goal to prevent serious illness in our population. There's 10 vaccines that have been authorized. I'm not going to go into the details of them, but they have been updated to better match the viruses expected to be circulating. And basically, the vaccine is safe and well tolerated. Influenza cannot cause influenza illness, or the vaccine cannot cause an illness. And the vaccine is really to protect yourself from influenza as well as to protect others and prevent the transmission. And just to note, the vaccine does not protect against coronavirus infection. So who should get vaccinated? Is anyone over 6 months of age, household contacts of infants less than 6 months, as they are higher risk and can't get vaccinated, pregnant women, travelers, carers of vulnerable populations, including the healthcare workforce, people working in childcare or aged care, people in essential community services, and those at higher risk. This is a list of those at higher risk, including adults over the age of 65, children under the age of 5, and all pregnant women, as well as those with chronic health conditions, including cardiac, asthma, and diabetes. I think the key message is really targeting vaccinating the kids, the youth and young adults this year and going forward. And the Canadian Pediatric Society encourages annual influenza vaccination for all children aged 6 months or older. We know that children under 5 are considered to be high risk for infection and flu-related complications. And they are efficient transmitters of flu, and they can introduce and spread the virus at home in the community. And we know that they derive significant protection from flu vaccines. So there's a systematic review that was done that showed the effectiveness of flu vaccine against hospitalization in children with an overall vaccine efficacy of 57 to 74%. Now, it's interesting, we look back at the Spanish flu and a lot of the messages to prevent influenza haven't changed that much in regards to what we're seeing now. So how can we maintain and continue to stay safe is remembering that protecting ourselves from COVID-19 also means protecting ourselves from the flu. So it'll be really important to maintain keeping up physical distancing, continue with hand hygiene, coughing and sneezing into your elbow, and cleaning and disinfecting frequently touched objects. Staying at home if you're sick or if you have symptoms, get tested. Wearing a mask indoors or if distancing may be difficult will decrease transmission of both COVID and influenza. And vaccinating yourselves and your families will protect yourself and others around you. And the other thing is to recommend vaccination for your employees as part of a Safe at Work initiative. So basically, the take-home message is really the single act of getting a flu shot this year will potentially save lives. It's, you know, a simple measure, almost the same as the idea of wearing masks. It will really decrease transmission and decrease the risk of spread and help protect others as well as yourself. It'll also help decrease the strain potentially on the healthcare system if we are expecting an increase or a second wave coming down in the fall. So keep up your washing your hands, staying 2 meters apart, get vaccinated. And of course, remember, flu vaccine should be part of your regular travel vaccines because you're always at risk as well for influenza when you travel, even in the off season. Great, thank you. That's it.
Aisha, can you go back one slide? To the one with the ad with the, so a gauze mask is 99% proof against influenza. I'm not sure but under that it says, the man or woman or child who will not wear a mask now is a dangerous slacker.
You know, it's actually funny because I highlighted that yesterday, but I found it a little bit distracting because I really love that. That's actually one of the reasons I put that up.
That's hilarious. And I think, you know, that's kind of true today, that you could say that. So I'll take you off your sharing. And so, okay, so I have a couple of questions, and then we had a couple of questions. You talked about antigenic drift, which is for the flu, and that's why it's, I guess, required to make a new vaccine every year because the flu, whatever the main flu is going to change. Do you know whether, or do we know yet, does that apply to the coronavirus as well? Like, is there antigenic drift as it applies to the coronavirus?
So in regards to the antigenic drift for flu, it really focuses on the proteins. Remember, we talked about those H and N proteins that are on the surface, and those can change. And we know that there can be up to 198 different types of strains available based on those types there can be different variations of. So as far as the coronavirus, they do talk about kind of genetic mutation for the virus, but in regards to specifically what we call antigenic drift in specific to the flu and the H and N proteins, it's not quite the same, just because it's just a bit of a different bit of a variation in the virus. And that's why we have obviously the need for introducing a new vaccine every year for the flu, is to try to really target to get a match, because the vaccine is actually targeting those proteins on the surface of the flu. It'll be interesting to see what information comes out from COVID-19, because that is something that they're obviously looking at and studying. So I can't say for sure, but that'll be the focus of the vaccine that's being in development for coronavirus is, you know, is it something that's going to be something that's like a one-off vaccine, or is it going to be something that we see on a yearly basis that's circulating similar to flu, where you might see variation in the protein or variation in a genetic mutation that may require a development of a vaccine every year. So that'll be obviously something that's in development and being researched right now.
It's so interesting. I think it speaks to how little we know about the coronavirus. The fact that this has been around for 6 months and you know, and that's it. Okay, next question. So I think you said that Australia, number of people, or the prevalence of people who get the vaccine is approximately 80%, you said?
So that was actually a survey done, so based on Flu Tracker. So usually their uptake of vaccine is, I would say 40 to 50%,
Okay.
but based on the coverage this year off their tracking, that was their flu uptake was actually a lot higher. So one of the surveys done, their coverage for vaccine was up to 80% of a kind of a subset that they had called and surveyed.
So with respect to Canada, typically it's 34.1% for 18 to 64-year-olds, but presumably we take the advice as Canadians this year too, and we also ideally will go up to 80% or even higher, right? Like get the guidance is get the flu shot this year. Absolutely.
I think that's going to be the push, is to get those numbers that people who don't usually get vaccinated get vaccinated, because it can protect against them. Remember, the symptoms may be similar, but it also will decrease transmission to others. So it's really the kind of the same idea of wearing a mask as a public health and a very altruistic move, is that you're really protecting transmission to others. It's the same idea with the flu vaccine, is we can bring down the numbers of transmission to others, but while at the same time protecting yourself. And we, as you can see, over the age of 65, where we see people who potentially are higher risk, they're getting up to 70% vaccination coverage. That message is getting out there. I think really the target should be the young adults and children really as well should be getting vaccinated, because those people may potentially be at higher risk. They may also be higher risk of transmission and co-infection with COVID-19, potentially, if they're not distancing as much. You know, it's not even just looking at the COVID pandemic, it's outside the pandemic. If we target that population who's not getting vaccinated as high usually, maybe our flu numbers on an annual basis of hospitalization and flu and death will go down, just if we look at a higher vaccination rate in the general population, looking even outside the pandemic. So it'd be interesting to actually look at that, because our flu numbers are quite high still.
It's yeah, that just seeing how much lower the prevalence of the flu was in Australia. That was crazy. Okay, well, this is great. Can you tell us? So can you get the flu shot from Medcan in your travel clinic, or what? If I'm a Medcan client, where do I get the flu shot from Medcan?
Absolutely. So you can book in to get it. Any of the nurses can administer it to you, or you can get it through your AHAs or through YRC and through the travel clinic. Obviously, the current vaccine isn't out yet. It'll be out in October. That's when kind of they're mandated to come out based on the government. Hopefully, we can get them out a bit earlier. I know they might be looking at that nationally, just in regards to kind of the pandemic risk. But definitely, come October, that's when you should be looking into calling up your doctor or nurse at Medcan to get vaccinated.
Fantastic. Okay, well, this is great. Gosh, it was so interesting. So don't be a slacker, basically.
Don't be a slacker.
So thanks a lot. So for people who are regular attendees of our webinars, we are transitioning from the spring schedule. We're moving we're actually off next week, so there aren't any webinars next week, and then we'll be transitioning to our summer schedule. We'll have Dr. Khatib back we're going to talk about how to fly in the pandemic age, right? This is something you and I have been discussing along with Dr. Peter Nord, but guidance on how to fly in an airplane. But I want to call it How to Fly. I just think it's a great title.
I think that's great. Yeah, so looking at kind of safety measures and what are the risks for flying during this time.
Absolutely. Okay, that's great. Well, thank you so much, and thanks to our webinar attendees, and we'll see you in the summer. Have a great weekend.
Great, thank you so much.
Okay, goodbye.